Okay, welcome back to part 5 of the basics of the brain, blood supply to the brain, and cranial nerves. We're looking at my blog, myroadtomedicalschool.blogspot.jp. We're looking at the blog post, basics of the brain and blood supply. So last time we left off with 63, so let's start off with 64. Where is the posterior communicating artery? It is between the posterior and middle cerebral artery. The posterior communicating arteries are arteries at the base of the brain that form part of the circle of Willis. Each posterior communicating artery connects the 3 cerebral arteries of the same side. Anteriorly, it connects to the internal carotid artery prior to the terminal bifurcation of the ICA into the anterior cerebral artery and middle cerebral artery. Posteriorly, it communicates with the posterior cerebral artery. Number 65. Atherosclerosis is most likely to occur in what type of vessels? Bifurcating vessels, for example, common carotid arteries. An example is an older patient who says they feel dizzy, and then through an ultrasound you might see stenosis or constriction in this area due to plaques, atherosclerosis. Number 66. The internal carotid artery has some very important parts. What are they? Well, first I've listed 4 parts, but actually there are 7 parts. So I listed the cervical, petrous, cavernous, and cerebral part. So I said the cervical part includes the sympathetic plexus, and the petrous part is in the carotid canal, the cavernous part is in the cavernous sinus, and the cerebral part will join the cerebral arterial circle. But actually there are 7 parts: the cervical segment, the petrous segment, the lacerum segment, this cavernous segment, the clinoid segment, the ophthalmic segment, and the communicating segment. Look on my blog if you want to see more detail on that. Number 67. Important points regarding the vertebral arteries. First, they are the first branches of the subclavian arteries, and they ascend in the transverse foramen of how many cervical vertebrae? 6, the first 6 vertebral vertebrae. And where do they provide vascular supply to? The cervical, spinal cord, and neck. They pierce the dura and enter the cranium via what? That's right, the foramen magnum. And they unite at the caudal ends of the pons to form what? The basilar artery. And they provide the posterior circulation of the brain. So now we know what the vertebral arteries do. So remember, they come off the subclavian arteries, and then they become the vertebral arteries, and then at the base of the brain they form the basilar artery. Number 68. If the internal carotid artery is blocked, how can blood get to the brain? Through collateral vessels. For example, with an emboli, a young person may die as the body has not yet formed collateral vessels, where there could be a blood bypass. However, in older people, they may actually do better in this case, as their body is accustomed to it, and when atherosclerosis may take 10 to 20 years to develop, sometimes older people do better. What should we know, number 69, what should we know about the cerebral arterial circle, aka circle of Willis? Well, it lies in the what space? The subarachnoid space, and it is an important anastomosis at the basis of the brain, and is formed by what? Remember we said that there were 2 anterior, 2 posterior, and 1 internal? So this anterior communicating and cerebral arteries. the posterior communicating and cerebral arteries, and the internal carotid arteries. And all components supply the brain by many small branches. Remember, 2 A's, 2 P's, and 1 A. Huh? That doesn't make sense. I wanted to say that there is 1 carotid artery, internal carotid. I should say IC. Okay, I'll have to fix that next time. Number 70. What is an important thing to notice when looking at the circle of Willis and looking at the MCA, the middle cerebral artery? When looking at the middle cerebral artery, you must notice that as you move towards the internal section, it becomes the internal carotid. Or from the other side, if you're looking at it, as it becomes the ICA. Also remember that the anterior communicating artery communicates between the anterior cerebral arteries. Also, the posterior communication artery can be used as an alternative to the internal carotid artery. You should know that when you're thinking about the posterior communicating artery, remember that it can be used as an alternative to the internal carotid artery. Remember, the basilar artery and middle cerebral artery supplying the brain are not part of the circle. The basilar artery and middle cerebral arteries are not part of it, so don't try to talk about that. Number 71. What is a cerebral embolism? Well, it's part of a thrombi, or a blood clot that breaks off and then travels to the brain to block some part of it, for example, a small artery, and this can lead to a stroke. So what types of strokes are there? Number 72, a hemorrhagic stroke. What is it? Well, first, they are less common, and this is when blood vessels burst or bleeds. A hemorrhagic stroke bleeds as a result of a weakened vessel that ruptures and bleeds into the surrounding brain. So this is a hemorrhagic stroke. So remember, the cerebral emboli are part of a thrombi, a blood clot that break off. The hemorrhagic stroke is when the blood vessel bursts. How about a berry aneurysm? This is a saccular type of aneurysm. Looks like a little berry. Some have it, but does not cause problems. And this is a breaking or bursting of a large blood vessel in the brain. So more about saccular aneurysms. They are the most common type of aneurysm and account for 80 to 90% of all intracranial aneurysms and are the most common cause of non-traumatic subarachnoid hemorrhage, SIH. It is also known as a berry aneurysm because of its shape. The berry aneurysm looks like a sac or berry forming at the bifurcation or the Y segment of arteries. It has a neck and a stem. These small berry-like projections occur at arterial bifurcations and branches of this large arteries of the base of the brain, known as the circle of Willis. So remember this definition. And a fusiform aneurysm is a less common type of aneurysm. It looks like an outpouching of an arterial wall on both sides of the artery, or like the blood vessel that is expanded in all directions. The fusiform aneurysm does not have a stem, and it seldom ruptures. Okay, let's stop there. Thank you very much.